Welcome to Castle Hill Hospital Centre for Cardiology and Cardiothoracic Surgery. My name's Ellie and I work here as a nurse. If you follow me, I'll show you around. You might be an inpatient awaiting cardiac or thoracic surgery, or a relative or a friend of someone who is waiting to have surgery. I'm going to talk you through the journey from leaving the ward, having your operation, and the care that you'll receive after your operation.
Morning sir, we've arrived in theatres and it's time to go through the theatre checklist. First of all, can I ask you your name and date of birth?
It's David Emmett and it's the 3rd of the 8th 1966.
Excellent. And are you allergic to anything that you know of?
No.
Can I ask you the last time you ate something, please?
Midnight.
And when was the last time you drank something?
The same time.
Once you've been handed over to the care of theatre and all safety checks are completed, you'll come into a room like this one. A team of people, including a doctor, known as an anaesthetist, will prepare you for surgery by giving you what's called a general anaesthetic. This involves keeping you artificially asleep, and during this time the anaesthetist will use a machine called a ventilator to breathe for you. You're ready for your operation now, so I'll meet back up with you once you've had your surgery. Hello again. We're here in an area known as an intensive care unit. Doctors and nurses trained to care for patients on ventilators will care for you. You'll have your own nurse caring just for you while you're on the breathing machine. And using lines and drains put in while you've been asleep in theatre, we're able to give you medications, take blood samples, drain urine and surgical wounds, and generally closely monitor you without the use of needles. When the time's right, we'll stop the medicines keeping you asleep and let you wake up. For a brief period of time, you won't be able to speak due to the breathing tube in your mouth, but we will be asking you questions that you can gesture yes or no to make sure that you're okay.
Okay, Dave, you're waking up from your operation now. Can you nod your head and let me know if you've got any pain? Okay, that's good. Can you squeeze my hand? Good man. Can you wiggle your feet? Lovely, well done.
Once we're happy that you no longer need the breathing machine, we'll remove the tube. Whilst you sleep off your anaesthetic, we will be working hard to monitor your progress and care for you. You may hear noises that the monitors make. Don't worry, these are just the monitors communicating with us and we are listening and responding all the time. Operation day is really quite a busy day, so try to get some sleep and we'll meet up again in the morning.
Good morning, Mr. Emmett. We're just doing the walk. Okay.
Yeah. Good morning, Dave. How are you today? I'm fine, thank you.
All right, Mr. Emmett.
Yes, I'm
What
fine.
we know, and just have a look at your charts then.
Thank you.
Okay.
Good morning. We start the day with the ward round and a team of cardiothoracic doctors and anaesthetists will review how you're doing and decide on the plan for the day. Try to eat a light breakfast to keep your energy up and help your body heal. Most people do tend to take a few days to return to normal bowel habits, and eating regularly helps things get back to normal. After breakfast, physiotherapists will come to visit you and assess your breathing and ability to cough. As a team, we'll be working together to ensure that you're as pain-free as possible and can cough well. This will help you avoid developing a chest infection. We'll provide you with a rolled-up towel to support your chest wound. We may remove some of the lines and drains if they're no longer needed to reduce the risk of infection, but you will keep your catheter and a line already placed in your neck for at least 2 days after your operation.
Hello there, is it Mr. Emmett? It is, yes. I'm just going to do a quick chest x-ray, sir. What's your date of birth?
3rd of the 8th 66.
Smashing. So what we'll do is we'll see you forward and then pop a hard ball behind your back.
Yeah,
Okay?
thank you.
Thank you. Sit you forward there.
Most patients will have a chest x-ray and then return to the ward that day. This is really a very busy time and we encourage your friends and relatives to visit you later that day when you're back on the ward.
Okay, sir, when I call out, all I want you to do is keep your shoulders nice and relaxed. Try not to move, just breathe in and hold it, okay? X-rays. Okay, Mr. Abbott, just breathe in. Hold it there. And breathe away, relax.
Thank you for taking the time to watch this film. If you have any questions, please do not hesitate to ask the nurse who is caring for you. The nurses working in the intensive care unit are more than happy to come and speak to you should you so request. Thanks for watching and goodbye.